Good Heart Hospice. What is hospice care? At Good Heart Hospice, we believe every patient deserves independence and dignity as they approach the final stages of their illness. We are a California-based hospice and palliative care provider dedicated to giving patients with terminal conditions the care they need to live comfortably, surrounded by a team of professionals and loved ones with their best interest at heart. What is hospice care? When someone seeks out hospice care, they are usually in the later stages of a terminal illness or life-altering condition and no longer want to attempt to treat or cure it. Instead, they have decided to seek medical care in order to live as well as possible for as long as possible and increase their quality of life. Hospice care provides them with an interdisciplinary team of professionals, including physicians, nurses, therapists, counselors, and clergy, to ensure the physical, psychological, and spiritual needs of the patient and their family are met as they near the end of their life. This team works together to manage the patient's symptoms, coordinate care, and make informed decisions to take the pressure off of the patient and help them live happily and comfortably. Many have the misconception that hospice care is the equivalent of giving up. On the contrary, patients seeking hospice care have decided to spend the end of their lives celebrating with friends and family, doing the things they love, instead of fighting a losing battle with an incurable illness from the confines of a hospital bed. Because of this misconception, some patients do not enter hospice care soon enough. In other cases, a doctor may not recommend hospice care out of respect for the patients and their families. It's important to remember that hospice care will help relieve stress and improve quality of life for patients reaching the end of their life. When is it time for hospice care? That is a difficult decision that should not be taken lightly. It is important to discuss it with your friends, family, and primary physician before moving forward with the process. Hospice care is generally sought out after a doctor gives the patient 6 months or less to live. In other cases, a patient may be ready for care if their condition, weight, mental status, or ability to perform daily activities is rapidly declining despite medical treatment. If the patient is ready to forego treatments aimed at prolonging life and live more comfortably, it is time to find a hospice care provider. Hospice caregivers provide a wide range of services covered under the Medicare hospice benefit, aimed at allowing a patient to live a stress and pain-free lifestyle. These include visits to the patient's home by the caregivers, medication to control symptoms and relieve pain, the arrangement of medical equipment and supplies in the patient's home, physical and occupational therapy, speech and pathology services, dietary counseling, short-term inpatient care, short-term respite care, grief and loss counseling, and any other Medicare-covered services needed to manage pain and other symptoms related to the condition as recommended by the hospice team. Services not covered by the Medicare hospice benefit include treatment or prescription drugs intended to cure the terminal illness, treatment or prescriptions for unrelated conditions, room and board in a nursing home or residential facility, or care in an emergency room, inpatient facility, or ambulance transportation unless it is arranged by the hospice team or unrelated to the terminal illness. The final stage of your life shouldn't be spent fighting a fruitless war against an incurable disease. Allow Good Heart's team of qualified and professional caregivers to help you spend that time in comfort, doing what you love, celebrating a life well lived with your closest family and friends. Good Heart Hospice can be reached on our website, goodhearthospice.com, as well as by email at info@goodhearthospice.com and by phone at 909-989-9988. Our offices are located in Suite 115 at 8237 Rochester Avenue in Rancho Cucamonga, California.